Hello and welcome to our weekly healthcare business update. My name is Mike McLafferty. I'm the CEO and founder for MJM Advisory and Educational Services. This week we want to focus on the Office for Civil Rights audit regarding HIPAA security for healthcare covered entities and business associates. This audit covered 166 healthcare entities and 41 business associates. I'm going to walk you through some summary of the audit findings, and then I'm going to make some step-by-step suggestions for how any healthcare organization or business associate can go through the process of a risk analysis. As far as the audit findings go, there were two areas that healthcare organizations did well in. One had to do with displaying in a prominent manner on the website the notice of privacy practices of the organization. And the second had to do with the timeliness of reporting a breach of data for individuals. However, there were a number of things that covered entities and business associates did not do well in. For example, even though that the notice of privacy practices was posted appropriately, the content of the notice did not meet the standards required. Well, same thing with the breach. Even though there were timeliness of the breach, the content of the breach itself did not meet HIPAA compliance requirements. So even though those two items were, one was posted predominantly and one there was timeliness, each one of them had issues with the content of what was posted or reported. Then there were a number of things that healthcare entities and business associates did not do well in. First, they did not provide a right of access for individuals to get copies of their electronic protected health information. Normally, this information is supposed to be received within 30 days of a request. And if the organization is going to charge the individual with a fee, the fee has to be reasonable. What the Office for Civil Rights found is that in a number of cases, the 30 days requirement was not met. It was significantly longer in a lot of cases. The last year or so, there's been anywhere from 12 to 15 reported issues here by the Office of Civil Rights. And in some cases, we're talking about 6 months, a year, or longer before patients got the information they requested. And the last item that came up within the audit that we believe is significant is that covered entities, business associates did not perform a risk analysis, and therefore they really were not managing the risk of the organization in regard in particular to any threats to the electronic protected health information. Based on these audit findings, in our experience, we expect now that the OCR is going to have HIPAA security compliance as a priority item for audits, probably for at least the next 3 to 5 years. So for organizations who have not taken the time or made the investment to do this, this is definitely something worth noting for you. I'm going to, at this point, walk you through some steps that will help any healthcare organization or business associate prepare and go through a risk analysis. First, you have to make sure that you have an inventory of all of your electronic protected health information. Computers, servers, CD-ROMs, any data that's been created, received, maintained, transmitted, the source of the information, and its location. You want to gather all of the relevant data, reviewing documents, meet with your staff. You also want to identify and document any potential risk or vulnerabilities. You've got to determine which threats are likely to occur so that you can focus on those. And once you come up with all of your risk and your vulnerabilities, you need to determine which ones are high, medium, and low. And then once you've done the analysis, you need to periodically update it. That includes making sure you have policies and procedures to support what you're doing. We recommend, given how complicated this is, that you consider a HIPAA compliance vendor or partner to help you through the process, since a lot of this is IT related. Thank you very much for watching our weekly healthcare update, and we hope to see you next time. Take care.